To stay healthy, we want to start off today's show by talking about Stand Up to Cancer and the state of cancer research. Many know that 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. And coming up, we've got on February 4th, which is this Monday, is World Cancer Day. And we want to take a look at what's happening now. So I want to show you a couple of stats that we want to get to before we introduce our first guest. The number of people who will be diagnosed with cancer in their lifetimes. I mentioned 1 in 2 men, 1 in 3 women. Number of people under 40 diagnosed with cancer annually in the U.S., 1 every 8 minutes. Astounding. The chance that you will know someone with cancer in your lifetime, 100%. Chance that it will be you, 33% in women, 50% for men. That's staggering. And this year, approximately 1.63 million Americans will be diagnosed with cancer, and about 572,000 will die of the disease. So we are definitely very focused, as we always are, on cancer research. With Monday being World Cancer Day, we want to take a look at where we are with all of this. So I want to introduce to you our first guest here, Kathleen Lobb, the co-founder and the founder of Stand Up to Cancer. Thank you so much for joining us from our Los Angeles bureau. Thank you so much for coming in today and talking to us about this very important topic and about all that is being done. Kathleen, welcome.
Thank you very much, Laura.
All right, let's start first with how and when Stand Up to Cancer was founded. Why did you start the organization? And take us through, introducing us to your organization, please.
Sure, of course. Stand Up to Cancer was actually launched in 2008, and I am one of 9 women who are co-founders of Stand Up to Cancer. I work for an organization called the Entertainment Industry Foundation, which was established in 1942 actually by Jimmy Cagney and Humphrey Bogart and Sam Goldwyn to try to unify the entertainment industry to address society's problems, at that time supporting World War II relief efforts. And we've continued in one form or fashion ever since, and have had a fairly major focus in cancer for going back close to 20 years now. When Katie Couric lost her husband Jay Monahan to colon cancer, she actually came to the Entertainment Industry Foundation saying, let's put a plan together as to how we can raise money for research on that disease, which remains the second leading cause of cancer deaths in the United States of men and women combined. So raise money for research and also generate awareness about how lives can be saved through screening for colon cancer. So that was actually work that we embarked on back in 2001, and at one point we were, a number of us, including Lisa Paulson, the CEO of the Entertainment Industry Foundation, we're talking about raising funds for colon cancer research, and somewhat out of the blue, Katie said we should ask the networks about doing a roadblock special, a televised fundraiser that airs across all of the major television networks to raise money for cancer research. And as we started to explore that idea, we learned that there were a couple of other groups of women who were pursuing essentially the same thing. Laura Ziskin, the famed film producer, was one of them. Sherry Lansing, former CEO of Paramount, was another. And ultimately this group of 9 women got together and said, if we could do something really special in terms of bringing the industry together around raising money for cancer research, what would that look like? The CEOs of the networks agreed to air such a roadblock special, which we did in 2008, and it has really been remarkable the way the entertainment community has come together. I think we probably have close to 400 major stars who have helped us at this point to raise money for this very specific model of cancer research, and the public has responded in a really extraordinary fashion. A colleague at an advocacy group of young cancer survivors said to me recently that he thought Stand Up to Cancer had helped young people feel that it's cool, to care about cancer and try to support the researchers who are really working 24/7 to try to end it.
Kathleen, you guys have such great numbers that we want to put up for our viewers on the screen. Some of your successes. The Stand Up to Cancer by the numbers. Funds pledged since the inception, 262 million. Number of scientists funded, 487. And the number of institutions joining SU2C, 87. I also want to read you, Kathleen, one of our viewers just wrote in from Raymouth. My dad and my uncle had the same type of cancer. My dad caught it early. He's fine. My uncle didn't, and he's gone. It is so important. Talk to us about how, the research and the research funding with that going on. Talk to us about the information that you try to get out for early screenings and to try to raise that awareness so that people like Raymouth's uncle can get in there and, if there's issues, health issues, possibly catch things while they still have a chance.
Sure. So let me just touch on the research model first. After the networks made this commitment to us that we felt confident we were going to be able to really reach the public, to raise funds for research, we went to a group of scientists with whom we had worked for years on colon cancer, breast cancer, and some other areas, and said, if you really could start fresh and you had a significant amount of money, what would you do differently to bring advances to patients more quickly, to get those treatments, to patients rapidly? And, one major thing that they said was there really aren't that many mechanisms that allow for researchers at one institution to collaborate and really work on a team with people pursuing the same areas, at other institutions. So that was the single biggest recommendation they made to us. Get the scientists to work together. So our model looks at dream teams of scientists, those numbers that you talked about. We have people at almost 100 institutions, edging up toward 500 scientists now who are working on teams. That the grants should be large enough to really make a difference, and probably most fundamentally, when the scientists, the teams receive these grants, to get something to patients within a 3-year time frame. So that's on the research piece of it. We, as I said, are so blessed in terms of these celebrities. There are so many aspects, of cancer where prevention is critical. Obviously, not smoking is fundamental. Smoking, is at play not just in many lung cancer cases, but 18 different kinds of cancer. Smoking plays a role in starting it. Diet and exercise. There are a lot of things that one can do to reduce your own, individual cancer risk, and all of your screenings, getting them in a timely fashion. Colon cancer, for example, everyone over 50 should be screened.
All right, Kathleen, I've got to leave it there. I want to encourage everyone to go to your website. We're going to put it up on the screen one more time so people can know where to go to learn more about what you're doing, how they can contribute. www.standup2cancer.org. Kathleen Lobb, co-founder of Stand Up to Cancer and the Council of Founders of Advisors. It's a mouthful, but very important, and I appreciate your time. Such an important piece of work that you're doing in this field. Thank you so much for being with us.
Thank you.
All right.